Hello, everyone, and welcome to GBMC's Greater Living. I'm Mary Beth Marsden. Thanks so much for being with us today. If you're watching online or you're in our studio audience, great to have you. We are talking about something today, a topic today that affects millions of people in this country, and there are probably millions more who worry about it, and that is diabetes. And as much as we think we know about it, I think everybody still has a lot of questions. So we're here to try and answer those questions for you, explain all the intricacies of diabetes, and also what's new and what's happening on the frontier of helping people manage diabetes, avoid diabetes, etc. So first off, we're joined by our expert right now is Rebecca Denison. Thanks so much for being with us. Rebecca is a registered and licensed dietitian and nutritionist and certified diabetes educator at Geckel Diabetes and Nutrition Center. And she does all kinds of diabetes education at GBMC. So really the sky's the limit on the questions, and I know you guys have plenty of them. So we're going to start really broad. And we were talking before we started the show today about exactly how many people have diabetes. We hear about it all the time, but we did look up the most recent numbers that we could find. And what do we find? More than 30 million?
Yeah, at least 30 million people have diabetes, and about 10% of the population. So 1 in 10 expect to have diabetes. And if it's pre-diabetes and diabetes combined, it's about 100 million.
Which is incredible.
It's a huge
100
number.
million people. And we're not, from your perspective, really turning the corner on slowing diabetes, or are the numbers seem to be kind of holding steady, increasing, going down?
They're holding steady lately. We were really building earlier. And so now it seems to be holding steady at the moment. But it still is building, and people need to watch it. Our culture is a toxic culture, and it doesn't support us to be healthy.
Right, and I think we're talking a lot about food intake when we're talking about that, but let's just start about...
And activity, and stress,
right?
And sleep. I mean, it's not just food.
The whole gamut.
It's the whole gamut. It's having
We're not
a healthy
living
lifestyle.
Right. All right. So let's try and change a little bit of that maybe, and start, what happens to our bodies when we become either pre-diabetic or diabetic?
So everybody has to eat food, and that food has to get digested and moved into small components that your body can use. The component that we focus on mostly with is diabetes. Is blood sugar. And blood sugar is like fuel in our car. So the gas in the car has to make the car move. In our bodies, the blood sugar is the gas. In the car, the gas has to get from the gas tank to the engine. In our bodies, it has to get from the bloodstream to the cells. So that's what this is showing, is that we eat the food, it gets broken down into blood sugar, and then insulin is supposed to act like a key to unlock the door to the cell. Type 2 diabetes is a little bit like the lock got changed on the cell, and not all the insulin got the new keys. So the blood sugar gets stuck in the bloodstream. And then you have honey going through your veins rather than water, which causes all kinds of problems.
I think, and that leads us to these props that you have. I'm hoping that everyone can see them because it's a good illustration of, let's hold up the healthy bloodstream.
This is the healthy one.
So see how are those the cells moving through?
So the white is supposed to be an indication of the blood sugar.
Okay, so that's the glucose or the sugars.
The glucose is going through your bloodstream, and it's a lot thinner than this one, where
it's goop.
It's going really slow. So this is an A1C of about 12 or 13%. I know the first person talked about having an A1C of less than 7. This is an A1C of about 6.
So that's a healthy A1C.
Right. So someone with a 6% A1C would still have prediabetes. Normal A1C is 4.0 to 5.6. So even this person still has prediabetes.
Wow.
So
and for the novice, A1C means what?
It's an average of what your blood sugar is over 2 to 3 months. And the way that number is obtained is it's a blood test, and it's testing the attachment of the blood sugar to the red blood cell. And the red blood cells live for 2 to 3 months. So that's how it comes up with that. And it should be a certain percentage of your blood. And so if it's too high a percentage, your A1C is higher.
So, which leads me to the question, it makes me want to go out and get my A1C checked. How often should we be checking that, and at what age?
So, can you show the A1C slide? I know we lied to you and told you it would be like the third one.
But, there it is.
Okay. So, I want to answer that question, but I wanted to have that up. So, I want to have a personal story. that I personally have prediabetes, and I would not have known it if we didn't get a new A1C machine at work, and I had checked my A1C by another person because we were practicing taking A1Cs. And that is how I found out that I had prediabetes. I knew I had a family history of it. I'm obviously in the profession, so I know this thing. So my personal opinion is if you have any suspicion at all, even if you're just overweight, you're at a higher risk for diabetes, but especially if you have a family history, to get that A1C taken at your physical once a year. At a physical, you can usually get a lot of different blood tests taken, and it's usually going to be covered.
And it's not the end of the world. Finding out some information about what is happening in your bloodstream can be incredibly helpful, and you can kind of stop it from progressing. Is that right?
Right, right. So you may end up having diabetes down the road. I expect I might by the time I'm 80, but I might not too, you know? I mean, wherever your weak link is where you're going to be challenged as you age. And so if you have the genes for diabetes, you can't change that, at least we can't at this moment with our current medical knowledge. But I do want to explain the A1C. So that 12% that I had over here, the thicker one, that means your blood sugar is around 300. And your blood sugar, if you're normal, would never go above 140. If you don't have any blood sugar metabolism issues at all, it would go up after you eat. It's supposed to go up after you eat, but it would never go above 140. Your body would make enough insulin, and that amount of insulin would work properly. Your body would make enough of it that it would work, and your blood sugar would come back down, and your kidneys would get rid of the extra sugar if you had Thanksgiving dinner and ate way too much pie or something, you know. So we want to be down here at 6% or lower. 5% would be about an average of maybe 100 to maybe 95, something like that. So that would be a normal.
Do you mind if I ask where you're keeping yours or where you've the last time?
You may, because I'm proud of it.
Okay, good. Let us know.
So I'll do some more personal embarrassment here. So I didn't check that I had it. I just started changing and lost a little weight. And then I just sort of forgot about it. And then we got another machine. We were practicing again. And mine was up to 6.2. Diabetes is 6.5 or higher. So again, from the health professional who should know better.
Was this a jaw dropper in the office?
Yes, yes. And I was like, that's not right. So I just made an appointment with my doctor and had another A1C taken just to make sure, and it really was up that high. So I paid way more attention, and now I have it taken regularly all the time. So I imagine know.
This
and it's 5.6 now, so that's
5.6,
normal.
Very good.
It was 5.7 for like 3 years, which is right at the beginning of prediabetes, 5.7 to 6.4. And I was like, okay, I can't get it down to 5.6. We're okay. But this year, on February, it was 5.6.
Congratulations. And I would imagine as an educator, this gives you such a unique perspective, and there's an immediate buy-in from a client or a patient that you have. Do you share your personal story with them?
Not with everyone, but with a lot of people I do. And most of the people, when I do share it, they appreciate that.
Okay.
You know.
So if you hear you have diabetes or prediabetes, then you have all these questions, right?
Of course, yes.
What comes next?
What comes next?
So you have diabetes. Are we talking, now we're talking medication. Or let's say with both, we're talking lifestyle change, right?
Yeah,
most likely.
Lifestyle is very, very key. And lifestyle takes a while to do. So you can't expect to do 100% of what you need to do the next day that you found out about it. That's one reason that we try to tweet our own horns here and say, come see a diabetes educator, because we're going to try to give you that education in a way and identify where you're going to get the biggest bang for your buck. What is the biggest change that you can make?
And what is that usually?
Well, it depends on the person, but anybody who's drinking sugary beverages, that's always a big one.
So food intake.
Yeah, sugary beverages are the biggie for food intake. Consistency of meals, having eaten meals about every 3 to 5 hours that you're awake, eating breakfast, losing weight, and it doesn't have to be the whole 30 or 50 pounds that you need to lose. It can be 5 or 10 pounds, and that makes a dramatic impression on the body. The body's able to function better just with 5 or 10 pounds. And activity is another big thing.
So when you're starting out with somebody new, this is overwhelming, obviously.
It's very overwhelming.
And you have so much information that you want to impart to them. But what is sort of the most important thing or the best way to start? And would it be to sort of rethinking food, rethinking what we put on our plate, rethinking our portions, or do you just judge by the individual person and where they are in their lives?
So I judge by what I perceive or they're telling me that they want to work on. So if I have somebody who's more interested in working on activity than food, I'm going to go in that route first, unless I see something horrible in their diet that I just think it's got to change, like drinking 2 liters of regular soda a day. I would definitely buzz in on that one. I'm sorry, we can't go anywhere else. We've got to talk about that. But so it sort of depends on what they're willing to work on and what their motivation is. So some people are more motivated by not starting insulin. And I couldn't get them motivated until the doctor says, we're not getting control. And now we're going to start insulin. All of a sudden, their ears are up. Okay, I'm listening. So it just sort of depends. But the 4 biggies for lifestyle is stress, sleep, activity, and food. And I would say most people don't eat consistently, and most people don't exercise. Those are like the 2 things I'm usually zeroing in on.
And even if we do eat consistently, are people really getting an understanding of what to eat, how to eat, what portions to eat? I think we've been getting mixed messages for so many years, depending on who you listen to. But for a while, everyone thought we needed to go low fat, which seemed to lead to high sugar intake and high carbs.
It does.
Right? But we're changing that plate, right? And we're lowering the carbs. And there's an example. And this is, would this be a plate that you would show someone?
Absolutely.
Okay.
So I think the biggest things that I see people doing are eating only either protein, carbs, or fat. They get zeroed in on one of them. And they think, okay, carbs are bad, I'm going to have protein. Protein's bad, I'm going to have vegetables. And you need a combination of everything. You can't have just one. So we've got this plate. There's a lot of other plates out there. So notice that half of this plate is vegetables. I will be honest, I don't do that at every meal. But it is something I aspire to. And that sometimes would be a goal that I would set for people was, let's have 1 cup of vegetables a day. And I really want you to have 3. Let's just start moving towards those vegetables a day. I would say every patient, and I don't think I'm lying, every single patient that I see that has at least 2 meals a day of this plate, dramatic improvement. Because the vegetables are the exact amount of carbs and proteins that you need. So you don't have to think so hard about it, you know. And the simplification of the plate is the size of your fist carbs. And you can see on the pictures up there that carbs are fruit, they're grains. There's also milk and yogurt that are carbs. And then everyone knows about the desserts, cakes, cookies, candies, pies. The size of the palm of your hand protein, and then 2 fists of vegetables.
The optimistic thing about diabetes is that there are things that we can all do to turn the tide.
Yes.
It's not a sentence of deteriorating lifestyle or deteriorating health. You can make a difference. And in fact, can you be diagnosed with diabetes or prediabetes and then come back and not have it anymore?
Well,
by making...
That is a controversy. In my opinion, once you're diagnosed with it, you always have it. Like even if I get my A1C down to always 5.6 or lower, I still believe my gene has been turned on, and I always have to monitor that. Because it's a chronic disease that's managed. But you can have well-controlled diabetes for ages and ages and ages, and that's what you want. There are people who use the word cure. I disagree with that. You get a person who has bariatric surgery, they lose 100 pounds. When they gain that weight back, there comes the diabetes again. I had a patient that I just recently saw in the hospital that I had seen a long time ago. She was in really good control. Her doctor told her she was cured. She quit monitoring, and she got put in the hospital with a 12% A1C.
Do you not like using the cure word because you think people will then think they can go back to their old lifestyle?
You go back to your old lifestyle, it's going to come right back. Yep.
Okay. We have a question. I think we have a lot of questions, but let's hit a few.
If fingertips and toes be a sign of diabetes?
It could be. It's not the most common sign, but that tends to be if there's either neuropathy, which is nerve damage, or just dehydration. because when you have thick blood going through your body's trying to thin it down, and it pulls all the water from any part of the body it can find, and that's going to dehydrate the other areas of the body. So it could be either one of those.
Thank you. If the blood count was 102 and normal goes down to 99, does that mean you have diabetes?
So if that's a fasting blood sugar, a diagnosis of diabetes for fasting is greater than 126. A diagnosis of prediabetes for fasting is 100 or greater. Normal is 99 to 60, I think.
And what did they have?
102 and normal, I think it says normal goes to 99.
So 99 would be considered normal.
Okay.
102 would be considered prediabetes from as far as diagnosis goes. If you have diabetes and you're checking your fasting blood sugar, you want it to be between 80 or 130. It's usually not reasonable to expect to get back to normal, which is like 60 to 99. I have a few patients who are able to achieve that, but not many. So usually 80 to 130 is what we're after. And this is for if you haven't eaten in 4 hours or more. If you have eaten, normal is 140 or less. And if you have diabetes, 180 or less. And I usually want my prediabetes patients to get to that 140 or less. I think that is reasonable. You can usually achieve that. The fasting is harder to
Let's talk about your diabetes patients. And I imagine they have to check their blood sugar all the time, right?
We do recommend that. Not everybody does, and I have patients that do okay without checking their blood sugar.
And let's talk about why that's been historically and what is new that you offer that has been invented in the last several years that has helped people sort of do that on a regular basis. I'm talking about the skin, the finger prick, and now there are new ways of not having to sort of maybe draw blood in such an inconvenient way.
So there are devices that people can wear on their bodies. This one right here is a Libra, Freestyle Libra. You usually wear it on the back of your arm. And this one right here is Dexcom. You usually wear it in your abdomen. And you will know what your blood sugar is at any moment in time. The Dexcom, you just look at your phone and it's there. The Libra, you have a little scanning device that you put over your arm, and it'll beep and you see what the number is. And so that is helpful for those fingers, you know. So I do recommend that people take them. But let's say we have a well-controlled person who's always in Target. Maybe it's not as important for them to take it. I usually recommend
because they're living their life in such a way
maybe
that
once or twice a week, just to make sure that you're still there so it doesn't get too far out. Ever.
Do you will find that people will kind of go off the wagon a little bit and have 3, 4 cupcakes or whatever it is, and then they take their sugar just to see how bad it can get? I mean, is that kind of a reality check for them, or?
I don't think many
sure
people have admitted that to me, but I think I've had a few that have admitted it. Yeah. But I do recommend that. I do recommend that people, they tend to take their blood sugar when they think they're doing good because they want to know if it's working.
Right. It's sort of like stepping on the scale, you know, if you're trying to, you kind of have, that number really just tells a story, you can't get away from it.
Yeah.
More questions, I believe. John?
Actually, yes. We have a question from Lynn who asks on Facebook, is it possible to go from type 2 diabetes to type 1 or vice versa?
No, there are 2 different kinds of diabetes. Type 1 diabetes is an autoimmune disease. And so something has happened in the body to destroy the cells that make insulin. And so those people are no longer able to make insulin anymore. Type 2 diabetes, there are people who progress to a similarity that the fact that their body's not making enough insulin, so they have to actually inject insulin. So that is confusing because sometimes people think once they start on insulin, they're type 1, and that's not the case.
Okay.
Yeah.
And this is going to be a terrible thing to say, but type 1, you can't control it. You got it. It's an autoimmune disease. Type 2, sometimes you may have brought it on yourself. Is that accurate with a genetic predisposition?
You have a what you said, genetic predisposition with that. But lifestyle is so involved in there. I don't like doing the blame game,
I know.
because then people feel like...
It's not about guilt.
Yeah, it's not about guilt, and they have to have the genes there. But yes, it is very much lifestyle controlled. And 90% of the people with diabetes have type 2, not type 1.
And this question from Mel, who's an audience member here, in treating your clients, do you require them to keep a log of what they eat each day?
It's not a requirement, but it is a recommendation. It is the #1 tool for weight loss and learning how to change, because sometimes, nobody would ever admit this, I'm sure, sometimes we're not even aware of what we're eating. And by keeping a log, that forces awareness. It also forces a change, because you're not going to write that down because I'm going to have to look at it. But that's not the main thing. I'm trying to get you to be more aware of what you're eating. And it's really amazing how I do the same thing myself, and this is my profession.
You're a coach. You're a coach.
I hope
You're
that way.
coaching people.
Yes.
And they can turn to you, for various needs, but and you have to kind of coach them where they're at right
Yes,
now,
absolutely.
to get them moving forward.
Yeah.
Another question, John?
Yeah.
Okay, we're getting the wrap it up, but there's so much more to talk about. So I just want to ask you, is there anything more that you want to sort of tell us that you think is so important that goes unnoticed, untalked about? Is it the stress management? Is it the sleep? Or we're starting to hear more and more about sleep. Is it or do you think we have a fear of exercise at a certain point in our lives, but not realizing that exercise can really turn the tide? What is it that?
Oh gosh, I just think
When you get on your soapbox, what's your big thing?
I think it's the realization that you can say, you have to take care of yourself. I have so many patients that feel like they can't do what they need to do for them because they're taking care of their children or their parents or their spouse. And that's important too. I'm not telling you not to do that. But you need to take care of yourself first. And I don't think our culture encourages that. And so knowing that sleep can impact your blood sugar so much, knowing that it doesn't have to be going to the gym, just movement. So the little Fitbit with the 10,000 steps, moving 250 steps every hour, little things like that. The stress is so key, because when we're stressed, we have a choice as to how to respond. But that choice is automatic inside our body, so we have to teach ourselves. So deep breathing, 5 seconds in, 5 seconds out. Couple times, anytime you're feeling that tightness in your shoulders or your jaw or wherever you feel it in your body, that gives your body a signal that you don't need adrenaline. Adrenaline is a precursor for cholesterol, which can cause you to have hyperlipidemia, high cholesterol, cause problems for your heart, and it also can cause your body to make more blood sugar. So the adrenaline you don't need that unless you need to fight or flee from a
Right.
robber.
You're running
or
from a
something.
lion, you need it. Other than that, we need to manage it. So many good points about just living healthier lifestyles.
Yeah. And you feel so much better and you're happier too.
Right. So be happy and treat your diabetes and find out if you're pre-diabetic and stop it from getting worse and really correct it. And good for you for doing the same. And I'm sure it's helped you really reach a lot more people.
And it's hard to do. So there are diabetes educators out there. And there is one at GBMC, the Geckel Diabetes and Nutrition Center.
Right, so take advantage of it.